Friday night and Saturday night. And hopefully you can join us for those as well. Thank you very much, and here's Dr. Bell.
Thank you for being here as a loyal and faithful, health-minded person. Seems like the people are very minded person and healthy are present all the time, so that is good. I know my parents are not here today because they had a trip to the doctors, but I know there are people online, and I hope that what we recorded here will be a blessing to others. We did learn about the nutrition that has been helpful in knowing that our food contributes to our health, and what we eat is what builds on our bodies, and also it can be a useful tool to not only to prevent disease, but it can help reverse some disease. We talked about movement, how to incorporate movement and motion into a healthy lifestyle. And the combination of nutrition and motion are very useful. We talked about those yesterday, and so the combination of that be helpful in reversing and preventing disease. Today we'll talk about body pain. We know when we have motion, and sometimes we get injured easily, and so this body pain can happen anytime and any location. So welcome everyone. Today we'll explore body pain. It's a universal challenge and experience that both the vital pain is both vital warning system and a complex clinical challenge. We will move from basic biology of pain to understanding its mechanism, and then discuss prevention and treatment options. Our goal is to provide clear, responsible overview, but always remember that severe, persistent, traumatic, neurological, or infectious symptoms require professional healthcare evaluation. So we'll start by looking at pain's fundamental role as a protective alarm. You know, when we have pain, then that really gets our attention to do something more. So pain is a protective alarm. Pain isn't just sensation, it's a protective alarm system designed to keep us safe from harm. It's an unpleasant sensory and emotional experience that prompts us to react before damage gets worse. So this means pain involves both the physical detection of a threat and our emotional response to it. So as we mentioned here, is sensory, combined sensory informations and emotional meaning. Emotional, that acute pain helps the body to detect harm. And also it's a protective pain encourages withdrawal. When you touch something that is burning, then we kind of withdraw from that to protect ourselves. So it's providing some healing as well, the healing to process. This protective function is crucial for survival. Now, let's break down how these pain signals actually travel through the body. You know, pain pathways has 4 steps. Building on the idea of pain, we can trace a journey through the body in 4 distinct steps. This classic pain pathway starts with transduction. You know, transduction is powerful stimuli are converted into electrical signals. So when we get burned, when we get pinched, that type of information is translated into electrical signals. So next to it, as you see, that transmission carries the signal through nerves and the spinal cord to the brain, and then modulation internal laws of nervous system to either amplify or reduce the incoming pain signals. And finally, the perception is when the brain creates the conscious experience of the pain. This sequence helps us understand how a threat to continue ultimately become a felt sensation. So we have a transduction, which is how transform the pain. These are nerve endings into the skin and the nerves. And when the nerve endings actually nociceptor call, they receive the injury, it converts that injury into electrical signals. So the electrical signals carry through the nerves through that type of sodium and potassium and stuff exchange, and then get into a spine called dorsal root ganglia. That is part of the spine, just at the entrance of the spine. And when you get into the spine, the transmission signal travels through the peripheral nerves and dorsal root ganglia, and so at 75 rate, it goes up into the spine, and when you get there, toward the brain, the brain has a location that receives that and increase that deformation or decrease that deformation. So there's a changing we call modulations, and into the spine here, in the posterior part of the spine. This is the spinal column. Spinal nerve. We have this gray matter here, especially along this back of this spine. There is a area that actually blocks the pain. You know, when you have pain, like a stinging pain, there is a nerve in this area that blocks the pain or modulate it before it gets into the spine. You know, when the nurse do injection on you, they will just do that. You know, that signal goes faster than the painful needle. So when you do that, tap your skin, it will get into this area, and it blocks the pain coming afterward. So when the nurse does that, you felt less pain perceived because the blockage at the spine is acting. And when you use spinal stimulator, that way it works. The spinal stimulator kind of stimulates this posterior dorsal column and block the pain from reaching the brain. Okay? So this is some 4 steps of pain. And now, following these initial steps of pain pathway, we arrive at the specialized detector that initiates the process. You know, we call nociceptors. Here is the detectors. You have the arm, and underneath the skin are some receptors. Our skins is a nerve. Skin is part of nerve. You know, that's why when you have someone and touch someone's skin feels good, feels like if you don't have skin, you don't have that feeling, because the skin has nerve endings in it, and either pleasant or very unpleasant. So here, if you have a very unpleasant, the nociceptive nerve, this is kind of receptors receives it, and from the skin, under the skin, and then the muscle has it. The muscle has less than the skin receptors. So this mechanism, nociceptors are specialized nerve endings that respond to potentially damaging mechanical, thermal, chemical stimuli, or any pleasant stimuli. The skin receives it. For example, a hard pinch, a heat, certain chemicals after causing injury can activate those nociceptors. It's important to understand that those nociceptors or nerve endings aren't simply pain fibers. They detect danger and send information that the brain then processes, which may or may not result in the conscious experience of pain. This detection system is incredibly sensitive, and its sensitivity can be amplified, especially by inflammation. So we have this say, oh, that is a tobacco burn on my skin. Oh, that is a kind of needle. Oh, that is a cotton. You know, it has a special endings in the nerve that really can tell what type of injury you're receiving. So now, as we've seen, those nociceptors detect danger, but inflammation can significantly turn up their sensitivity, making pain feel much more intense. So when we have this injury, then we have inflammation and make it worse. After an injury, damaged tissue and immune cells release chemicals, mediators like histamine or prostaglandin. And these chemicals can activate or sensitize those nerve endings, leading to increased pain. This explains why a sprained ankle hurts more when you touch or move it during early healing phase, because inflammation is a vital part of the healing process. So it also contributes to more heightened pain experience. So we have pain, tissue damage release chemical signals, histamine, prostaglandin, the protein, bradykinin, and those inflammation immune cell create swelling, because those come into the area that is injured and causes swelling. And those swelling and fluid pushing on those nerve endings create more pain because of the intense because of the intense pressure, possible pressure in these nerve endings, and these chemicals irritate those nerve endings, so the inflammation, it's hypersensitivity right there, cause more pain. But this inflammation is actually necessary for healing at the same time. So sometimes we don't need to control inflammation because it's part of healing, but we don't let it be overwhelmed by it. So now, as we've seen, inflammation can sensitize our pain system, and now we'll focus on where much of this body's pain originates. Okay? The musculoskeletal pain, the movement tissue. This tissue constantly under the load and movement, making them frequent site of pain. So these are the site of pain. Bone creates deep aching pain. Joint can feel stiff, so throbbing or activity-related muscles, maybe aching, cramp, spasm. Tendon, ligament, those are the nerve for the sharp movement-related pain. So the site of those musculoskeletal pain is in the bone, in the joint, in the muscle, in the tendon, and those structures has nerve ending in there. So it can be seen in the shoulder. The shoulder has muscle, it has tendon, it has ligament. The knee joint has ligament and has muscles. The ligaments are the structures that connect bone to bone. Tendon are structure to connect muscle to bone, and muscle are muscles, okay? So muscle fiber here, the muscle fiber, it can contract to move and support the body and nerve branches. So those are locations of musculoskeletal pain. These tissues are constantly under load and movement, making them frequent sites of pain. We can say if we have a deep ache, may point to bone. Well, a sharp pain with movement often suggests the tendon and ligament tissue. Over, remember the pattern, you know. We need to have a clinical evaluation. When you twist your ankle, what type of injury is that? Twist your ankle, most of the time, it's ligaments. Those small ligaments between bones can be disrupted. When we have ankle, knee issues, the knee has muscle and the tendon, it can be the tendon and the bursa. So these are type of location of the pain. Now, this is for delayed onset muscle soreness. Very common symptoms, delayed onset muscle soreness. We know to see the muscle, said the fascicles as a bundle of muscle fiber. And he said this muscle fiber, we have one muscle fiber, individual muscle fiber. And he said that individual muscle fiber, we have a sarcomere contraction unit. And he said that sarcomere have a Z disc microstress. So these are breathing this a system that can hold the muscle tight or contract the muscle or release the tightness. So here is the inflammation that may happen that can affect from the most small part of the muscle. Then you can feel through this big unit of the muscle. This delayed onset muscle soreness is self-limited muscle soreness typically occur after unfamiliar, intense exercise, eccentric exercise, and become noticeable. We have some exercise that we have done before, new exercise, increased type of exercise. And then in about 24 hours, we feel like, I have soreness here. Need much more in about 2 days, 4 days, that type of pain is more very noticeable. And it takes a recovery of a week. And what do we do about that? This is sometimes when you walk in a yard and then come back and then not right away, but maybe the next day feel like, man, my leg is so painful, I cannot even walk. Have you experienced that? When you do some type of walk or hiking, and especially downhill, and you made it there, when you get home, sleep that night, woke up in the morning and said, I can't really raise my leg. It's like full, it's bad. This is the delayed onset muscle soreness. It really happens most of the time in the thigh here, in the calf, and eccentric. So when you load something, lower things down, it is a muscle when the muscle is lengthened when support the body. Any muscle that lengthen, those are easy get short. Maybe in the back of the shoulder and so on, in the biceps. This is delayed onset. Sometimes when you get this pain and you say, I'm gonna rest today because really I had a bad weekend. Resting is not the real treatment. I tell people, I say, when you do it again. Do the same thing. Because do it again with less intensities. You know, that is the recovery for this is the right movement. Don't just sit there. It takes longer to recover. You need to do the same activities but in much less intensity. And so get a lot of water, rest a little bit, and you get enough progression. You can tell, I can tell you, it helps a lot. Sometimes I do some exercise that I can say, for 1 or 2 days I feel sorry, and I will do that again. With a less intense, the recovery is speeding up. Because there is inflammation there, and the inflammation created release of inflammatory mediator, and nociceptor sensitization getting worse. And so this is a common trigger when you're lowering weight, doing some lunges, downhill running, jumping, sudden increase in training intensity. And so we need to prevent if you can have progressive loading or warm-up. And so hydration and nutrition. But the recovery is better when you do it again with less intensity and water and stuff. Because sometimes even pain medication does not help you. Because it feels like heavy, swollen, full. You just need to do it again. Okay? Acute and chronic pain. Acute pain is a pain that is what happened. Acute pain is a pain that really caused by something and injury, and you know that injury happened and the healing is predictable. And say I had injury injured my leg, it's swollen, it's tense, but we know it's going to heal. And the healing is critical. Chronic pain, when you have injury, and because the pain doesn't stay in the same place, it's become spread and causing sensitization from multiple parts of the body. Then not only the pain, but it transforms the person into having difficulty sleeping, have reduced mobility, have emotional stress, and more, all kinds of problems. If pain persists more than 3 months in a location that's supposed to heal, then that person can get into chronic pain. Let's see, someone who has back pain or pull the muscles, and then the next day painful, in a week still there, 2 weeks still there, 1 month still there, 2 months there. If it's continue on, get worse like that for 3 months, then you need to worry because that person may have difficulty with pain in the back for a long time. So we need to treat acute pain within a reasonable duration because we don't want that acute pain to become chronic pain. So this can lead to a cycle of reduced mobility, sleep disturbances, emotional stress, making it much more than just prolonged acute pain. It's not the pain only the problem, it is the well-being of this person who is an issue. Because if you don't sleep, you are in pain, you disturb the people around you, and it's become an issue, social issue. So we need to treat them well. People with whiplash, injury, car accident, whiplash can be a source of that. If it's not treated early, that neck pain can be really an issue for a long time. So move out of this acute pain, chronic pain. Pain related to spine and pain not related to spine. It is known that the pain related to spine is about 60% of all pain. Most of the pain is mostly related to spine, especially people who have been pain more than 3 months. About 30 or 40% of the pain are related to peripheral joints, fibromyalgia, chronic headache, pain in the tummy, and other kind of pain. So if we have 100 people, 60 of them may be related to that. And so this one will related to non-spine. So out of 100 people living in chronic pain, roughly 60 have spinal related pain and roughly 40 non-spinal related pain affect the joints and some of the muscles. So let's talk about the spine anatomy. Spine. Spine has a complex and vital structure acting as both a load-bearing column and protective highway for our nervous system. Each spinal segment here consists of 2 vertebrae and an intervertebral disc. So spine is a column that really keeps our body straight. Also, this bone protects the nerve here. Its spine has 2 segments. One here, spinal vertebra, and the second one, and in between have a disc, So those are, and these are opening at the side of the spine called foramina. And this opening needs to be kept open, otherwise the nerve that comes out of that opening get pinched. So this is what we call pain. The spinal cord is a critical part of the central nervous system, runs through the vertebral column. So this is the spinal cord all the way from the brain down to the tailbone. And this is protected on the bone, inside the bone. And inside the bone, this spinal cord, like a tree, there's a ramification, the branches come out of those holes. We call roots. The nerve roots come out there at different level. And each segment innervates the thigh, some of those in the muscle of the leg, some of them in the muscle of the feet. And so it's very specific. So when we see this, the vertebra and disc, and between the vertebra and the disc, this connection here is called facet, and here is the nerve root. So those are in the back of the spine, the muscles that cover this along the spine called paraspinal muscles. So those are the structure of the spine. So next, let's delve into how the specific component of this structure can become source of pain. Let's see. Disc and facet become pain generator. Disc is here. When these discs are so normal, healthy, has a lot of fluid in it, it's have a good length. When you walk during the day, at the end of the day, those discs get thinner. So we are shorter at the end of the day. And when you sleep at night, those discs really absorb some fluid and it's feel full. So when we wake up, we have to look taller. You know, those discs, then it's get expressed. So sometimes people have more pain in the morning. My back is kind of really sore in the morning. The reason is this disc is pretty full when you sleep at night, and in the morning you put weight on it and then kind of put pressure on those discs and kind of sore a little bit. So this is the degenerative facet here. The disc, when the disc is so thin, then the bones start to share the load of the body. And so this degenerative disc loses the hydration and height, and maybe has some fissure, inflammation, then becomes sensitive because there's around this disc has some nerve ending. When this has fissure like the tooth, then it will become very sensitive and has some inflammatory component come out, and so it's really can be very sensitive. Inflammation there and affect the disc, affect the spinal vertebra, and so when this disc is very thin, this bone get close together and get this capsule facet become also affected. So initially, this spine, the disc carries the load of the body. When the disc gets degenerated, the load carried by this posterior part of the spine called facet. So the people at the age of 50, 60, 40 have pain related to the facet. The younger people in the 20s, 30s may have pain related to disc. So that's the change. We have. Most younger people have this disc bulging there. But when you have older and the disc is really not there anymore, then it may not feel as much painful, but have pain related to the bone. So let's move on to the nerve roots. Compression create pain. We talked about the disc, but now radiating pain. We have this herniated disc right there, or body. This can be compressed by, this nerve can be compressed by a disc or compressed by bone spur from the facet. And the herniated disc or bony spondylosis can narrow the canal and cause pressure on this nerve. And the compressed, the inflamed nerve root can cause tingling, burning, and shooting pain all the way from the back to the leg and so on. Depending, it could be here in the back of the thigh, to the calf, or in the front of the thigh, down to the calf, in the front of the foot, in the back of the foot, depending on the location. So the lumbar L4, L5, and L5S1 develop the most common site of this radicular pain called sciatica. So this is the map. Pain from L1 is there, pain from L2, pain from L3, from L4, from L5, S1, and S2. So if you touch the skin of people, and you can really tell and say, you have this affected in this level, okay? Because of the structure that really tells you that. Now, this is the spine inside the spinal stenosis, is nerves of this nerve highway. Here is the spinal cord right there, the disc, and then here is the spinous process, which is the spine, the back of the spine. When we have arthritis of the spine, this opening that's supposed to be open nicely get tight. You see that? The spinal cord is so tight inside the spinal column. And what happens? It can cause by thickened ligament, by bone facet hypertrophy, bone spur, and compressed nerve root. So when we have this, the nerve does not have any room. And when this happening gradually, people may not even feel it. But when at the later stage, people might, this patient can have difficulty maintaining balance or difficulty standing for a longer period of time. The very sign of people with spinal stenosis is here. Walk with standing or walking, have a lot of pain in the leg, and sitting, feel better right away. You can say, I can walk for about 50 feet, but I cannot continue on. My leg feels like weak and painful, like a noodle. I have to sit down. And when I sit down right away, the pain is gone. Then I go again, walk, continue on. So these symptoms is the spinal stenosis. The treatment is to remove this bone that compresses the nerve and allow the nerve to have some room. So these are the spinal stenosis. You know, degenerative change like a disc collapse, facet overgrowth, thickened ligament are common cause of that. And so the leg pain, the numbness, the weakness, the worse with standing and walking, and improves with sitting. And so if it's happening in the neck, then can cause arm symptoms and balance problems, even difficulty to having good reflex. It can really jumpy reflex. This condition often feed into complex pain loops. So we'll explore that. We have pathology and injury often create these pain loops where various factors interact to sustain discomfort. These loops are complex, involving more than just a single injury or tissue issues. For example, back pain might involve muscle strain, joint irritation, fear of movement, even sleep disruptions. And so recognizing that is very helpful. Let's start with one. You have tissue injury and have inflammation, and so the nerve is signaling that they have problems here, and the muscles around it are very guarding it, you know. That happens with people with back pain, for instance. The pain is there, the muscles surrounding those tissues are inflamed and cramps, the muscle protecting that area with guarding and cramping and simple myofascial exercise, and so on. But when you start to have bone growth and disc pinging on nerve, then those are need a very specific treatment. So prevention begins with tissue capacities. What should we do? Given how easily pain can become self-perpetuating loop, prevention becomes our first and best line of defense. It all starts with building tissue capacity, which means gradually strengthening our bodies to handle the demand we place on them. You know, when we are, let's see, we talk about gradual exercise. We cannot start to build up so much weight. You start with small exercises. We talked about that yesterday. Practical exercises and stretching, mobility, flexibility, lifting, way of lifting. You can use the big muscle when we lift. There is some protective gear that we can use for your knees, for our elbows, and help sleep, because if you have good sleep, we are less sensitive to pain. And also ergonomy. You know, there is some place where you have to sit upward or stand upward. That can trigger exacerbating factor of the pain. So prevention is beginning with tissue capacity. So we need to build up a tissue that is flexible, able to coordinate those tissue well, and also have a gradual strengthening of those tissue on a daily basis. And say, this is the activity I'm doing every day. I want to strengthen those muscles that works for me. When you have injury, then early care protect healing. You know, what are the early care? We talk about when minor pain occur, early care is crucial for protecting the healing process. Sometimes complete bed rest is rarely the goal for most pain related to the muscle and the skeleton. Instead, we focus on relative, means avoiding bed rest completely, because it sharply worsens symptoms and make your muscle get weaker as well. So using ice or heat can help manage discomfort. If it's really acute injury, just happen, ice help relieve inflammation, spasm from the muscles, calming. If it's you can alternate heat and cold. Usually alternate is like as tolerated, and then protect the joint with relative rest, not really full rest, and try to restore it with gentle motion. And if you need some pain medication like Telamon, you can add it so you can make motion. So ice, elevate, compress, and move gently. Ice, elevate, compress, and move gently. So those are way to early intervention. Chronic pain needs multimodal. When the pain is lasting more than 3 months, then you need to deal not only with the pain, but the whole system. You know, when pain becomes chronic, you need to have a broad approach. They are highly individualized. One thing that may work for one person may not work for another. And medication can certainly may play a role for some patients, but they are rarely the complete solutions. Instead, we focus on improving function, improving sleep, improving the mood, the strength, and confidence with more movement. When someone gets hurt and have pain for a long period of time, it affects their work. This person may say, I call sick often. And when people are away from work for 6 months, the chance of returning back to work is very slim. So we need to get people back to work, even part-time, when they have injury, because work is a healing at the same time. So the treatment is educate patients. Education help patients understand that pain and feel of motion need to be addressed. Physical therapy, home exercise, restore strength red flags. With all this pain, we need to know what's the red flags. Red flags is if you have a weakness and numbness, then we need to know that weakness nerve pinched. Numbness is some soreness of the nerve. So incontinence, lack of sensation in body part, though you are red flag. Trauma, if there is fracture, cannot bear weight, then it may be a trauma. Persistent worsening of pain that not improve with the appropriate treatment, need to see. Infections, no, we need to find, but some pain is really underneath the pain could be a cancer, so there's some red flag, especially pain at night. People with pain at night need to make sure, especially if they are about 60, 70 years old, think about if this person may have a cancer. So severe pain, persistent worsening pain, pain after major trauma, inability to bear weight, weakness, fever, infection, spreading redness, infection sign, unexplained weight loss can be a cancer, pain that does not improve with appropriate healing. Those are some of the red flags that we need to address for people with pain. Now, there's a lot of things that we can talk about pain, lots of things, but we can end there for today. We must remember that body pain is a complex experience, not just the simple symptoms. It arises from intricate interaction like inflammation, movement, sleep, stress, behavior. But we need to listen to the pain, listen to your body, assess its origin, and respond wisely. Prevention is the building capacity. Focus on strength, mobility, recovery, balance, flexibility. You know, when we do some stretching, for instance, that's help. Sometimes the balance is not an issue, but tightness, getting up into the steps. If some of the hamstrings is tight, we cannot raise or negotiate a curb. So knee motions and range of motion, those are what we learned 2 days ago about few flexibility exercise, balance exercise, coordination exercise prevent pain for long run. The best outcome come from understanding the root cause, protecting healing tissue, restoring movement, and seeking professional care when pain is severe and persistent. I hope that helps you to understand pain, and I hope you don't need to have it, but it's part of life. Since sin entered the world, people start to have pain. And the good thing is that in Revelation says there will be no more pain. And God bless you for that. Let's have a word of prayer. Our Heavenly Father, thank you for giving us understanding about pain. Pain is something that comes with sin, and we live with it. And so there are many things that can hurt physically, emotionally, spiritually, and we are praying that you give us a way of help to restore and cure and treat this pain that is afflicting the people that live in this world, that is really needing the redemption. When we are thinking about heaven, we are looking forward where there's a place where we cannot even experience any more pain. No more crying, no more dying. Thank you for your presence. In Jesus' name we pray. Amen. We have a short workshop that we would do. No exercise that can harm us, but just explanation about why we might have pain and what should we do about it. Thank you all.